The U.S. Senate is about to begin debate on health care reform. The issue is steeped in controversy as Republicans and Democrats battle each other, and some Democrats fight among themselves over the best approach to changing the way Americans get health coverage. KTVU's Maureen Naylor reports.
The health care discussion played out on the Sunday talk shows as the Senate prepares to begin weeks of debate on its plan starting tomorrow.
We'll make premiums go up because taxes go up to pay for it, and we'll never cut Medicare benefits to make it work, nor should we.
We are the only country in the industrialized world that does not guarantee health care to all of its people, and yet we end up spending almost twice as much per person as any other country on earth.
The yeas are 60.
Political watchers say the 60 Democratic votes that were crucial to moving the bill forward are no longer there, as support for the Senate's $848 billion health care reform bill seems to be fracturing. Some Democrats are calling for tighter restrictions on abortion coverage, while others want to drop the government public option. Almost every Republican is against the plan.
The war is terribly important. Jobs in our economy are terribly important. So this may be an audacious suggestion, but I would suggest we put aside the health care debate until next year.
We have to go ahead and conclude this debate. To stop now would be stopping on the edge of, I think, significant reform, which is so important for the country.
At Mineta San Jose Airport today, we found the public ambivalent about the Democrats' legislation.
I'm a radiation therapist, and I'm not real sure. I just, haven't really looked real into it yet, and I want to research it a little bit more before I make a decision.
I don't think it's a good idea the way it's going now, but based on what I've seen, I'm not really sure if it's the right direction yet.
According to a new Kaiser Family Foundation poll, 58% of those surveyed wanted elected officials to tackle health care now. Yet about half of those supporters say they don't like what they're hearing about the options.
It's incremental. It's a step in the right direction. No, it's not everything I'd like it to be, but it's moving in the right direction.
I guess it really boils down to what are we trying to accomplish with this? If we're trying to reduce healthcare costs, I think there are ways to do that, and this is not one of them. I think this is going to increase healthcare costs.
The Senate bill is expected to have many amendments, likely surrounding the topics of limits on malpractice lawsuits, affordability, and drug prices. The debate's expected to start off modestly tomorrow, with each side offering one amendment, and no votes are scheduled. Senate Majority Leader Harry Reid hopes to conclude debate by Christmas. In San Jose, Maureen Naylor, KTVU Channel 2.